what I need to be doing now is I need to be applying the lube right here. And I need to make sure that I am able to visualize where I'm going to be going here. So I'm going to ask Dr. White to please pick up our patient's head and take us behind the maxilla, or on the maxilla behind the upper canines, please. So I need to make sure that I pull this tongue out. So pulling the tongue out, and then we need to go down, visualizing and tubing. Okay, the tube is in. Please place the head gently down. Keeping the dog in sternal. We need to keep the dog in sternal position. Okay, now we just need to tie the tube. So if you can hold the maxilla above there, please. Hold the maxilla. So now we need to tie the tube here, and we need to tie the tube behind the upper canines. So looking for the upper canines and tying in behind here, making sure that you are behind the upper canines, and tying behind the dog's head here. Just like so. So we are snug there. So now what we need to do is we need to move over here, and we need to check just to make sure that we are in. Excuse me, Andy, do I come over here?
Yeah, I'm just looking here.
So we need to make sure that we take this tube off, and we need to make sure that we press gently on the chest, and we've got a piece of gauze in front of it.
Sorry.
And we should be seeing a little bit of movement there, which we are. See how that's moving? So that's one indication that we are in. Now I'm going to hook the dog up here to oxygen. So Hazel is now hooked up to oxygen. So we have our pilot cuff here, and we need someone to pass me a syringe, please. I need a syringe. So here's one here. So we have a syringe, but before we do any inflating, what we need to do is make sure that our dog is on oxygen, which it is. The flow rate has already been determined by our technician here, and we need to close our pop-off valve. So closing our pop-off valve. Now I need to listen. I'm going to listen for a leak, and I need to inflate until 20. Sure that my pop-off valve is closed, which it is, and then I need to make sure that I attach my syringe here, which is inflated, and I'm going to give 1 to 2 mils at a time. So I need to make sure I give a little cup of oxygen here, and I'm going to listen, not going above 20, 15 to 20, and at the same time I'm going to give a couple mils of oxygen, because we can see and hear that there is a leak there. So we want to do the same thing again, making sure first though we open first, give it a second, then close, going up to 15 or 20. There's still a little bit of a leak there, it's not holding, so we need to give another couple mils, making sure we're ears to the patient. Now it's time to open again. Open, then close, and then have a good listen. Giving a breath, releasing, giving a breath, releasing. And now I need to open again right away, and I'm not hearing a leak at this point. So, a couple of ways now that we are going to be able to know that this tube is placed. We know that the tube is placed because there's fogging occurring in the tube. I could feel the patient's trachea here. I should only be feeling one hard structure. If I'm feeling two, then the tube is in the esophagus. So I want to make sure that there is nothing dorsal to the trachea here. I'm only feeling the one tube there. Again, I put the gauze in front. We are seeing this here. And we're going to be watching the reservoir bag, right, as you can see right now. It is opening and closing here. And then we're going to be hooking the patient up, and we're going to be able to see that we do have carbon dioxide output. So that's another way that we're going to see that this cuff is for sure placed. Finally, I'm going to listen with the stethoscope. You can pass me the stethoscope that's behind you, please. I'm going to take my stethoscope, and what I'm going to do is I'm going to give a breath again and bilaterally resuscitate the lungs. So closing here. Giving a breath not above 20. And releasing. Open right away. Release the pressure. Close again. Again, bilateral resuscitation, so listen to your other lung. Up to 15 to 20. And then releasing. And then make sure you open directly after that. Okay, and then we're all set with that.